thankful to Dr. Vimy, and on the top of that, I'm thankful to the Mr. Jain, who I believe who leads the management team of Gyan Ganga Institute of Technology. Thanks once again for giving me this opportunity. Javed has already mentioned about me. Since I will be talking about sustainability, going along all the smart cities infrastructure, because these days smart cities, they are trying to be sustainable smart cities. And what is the difference between smart city and sustainable smart cities, that I'm going to talk about? Definitely I will be asking you that what exactly sustainability refers to. Here I just want you to mention, when we talk about sustainability, ladies and gentlemen, I'm not here to blow my own trumpet, but what I want to tell, that your speaker of today, he completed his diploma in 1987, and since 1988, if you can see, the speaker of today started working, and without any gap, continuously he has been working till today. That means as much as 30, almost 36 years, I 36, 37 years, whatever it is. And along during this career journey, your speaker of today, he has improved his qualification. Once again, I repeat, it is not something I'm going to blow my trumpet. What I wanted to mention, that this is a sustainable practice. That means your qualification, your career, both are approaching sustainably without endangering any of the attributes. Maybe it is profession, maybe it is academia, maybe your social life, maybe your responsibility towards society, maybe your responsibility towards this planet. So this is one of the important feature I'm going to discuss while I'm talking about smart cities. All right. Yeah, he has already told much about me, Javed, so I don't need to explain more. Ladies and gentlemen, today's agenda will include this, but will not be limited to these points. Definitely, I'm going to talk about smart cities. And I would like to know from you guys that what exactly is smart cities. And then we can come towards this healthcare system, remote patient monitoring, that topic that has been given to me to talk about telehealth, and then what is the difference, which is better, which is inferior, what are the advantages, what are the challenges, what are the bottlenecks, what should be the roadmap, and then lastly there will be concluding remarks. My friends, I have a bad habit of asking questions. Can somebody tell me what exactly smart cities are? Can somebody tell me what exactly smart cities are? My friend, I don't know. Or maybe you can improve my understanding on the concept of smart cities. I can see that there are as many as 125 participants attending. Can somebody educate me a little bit, or give me a deeper understanding about smart cities? You want to talk? Most welcome. You want to write? Most welcome. Anyone? You can even write in this question and answer. There is a chat box, I believe. Javed, did you get any response from anyone? Has anyone written what exactly
Uh,
smart
s-
cities?
yes, sir. Many participants are writing the smart city means that the automation, new technologies, very good healthcare, and use the digital things, ICT technologies like that, sir. Collect the data between the infrastructure.
Ladies and gentlemen, very first thing, thank you very much for sharing your thoughts and sharing your inputs. But I believe,
Sir,
yes,
sir,
yeah.
smart,
Yeah,
yeah.
please go on.
Sir, smart city basically, according to me, is how you can have smart living in a city by using information and communication technology like ICT. how
Okay.
you can make a
If I may
living
ask,
better.
okay, if I may ask, are you a faculty member in ICT or you are an industry professional? Would you like to introduce yourself in one sentence only?
Yeah.
You are from academy or
Sir,
you are from industry? Yeah.
I have industrial experience, and also presently I'm professor in computer science and business system. I'm heading the branch. And
All right.
regarding ICT, sir, I do have experience in working with ICT and
All
teaching
right.
subjects like e-governance.
Yes. Thank you very much. Nice to know about you. Ladies and gentlemen, actually, this is the irony. Whenever we talk about smart cities, everybody starts talking about ICT, information, communication, technology, that there are remote sensing equipment, there are tall buildings, there are machine equipment, there are buildings or infrastructure which are well equipped with electronic features, electronic gadgets, there is monitoring system, there is
Sir,
all this that. Yes,
sir,
somebody
may
saying
I
something.
answer?
Yeah,
Yes,
please
sir.
go
Good
ahead.
evening, sir.
Yeah, your name.
Good evening, sir.
I will
Doc,
appreciate if you share your
ma
name and you
yes.
share your affiliation in one sentence only.
Okay, sir. Okay, I am Dr. Nidhi Mishra. I am working as an assistant professor in engineering college. I am from electrical engineering branch.
Very
So
good.
I would like to answer your question. First, what do you mean by smart? Smart means intelligent system, decision making system. So if you are knowing about the smart cities, it means whenever whenever the things are required
Hmm.
intelligently, we can use.
Hmm.
मतलब it should be power of decision making.
So basically, we are just around. We are revolving around ICT. We are revolving around technology. Am I correct? So
Yes.
far, the two opinions actually, I appreciate. Very first thing, thank you very much for both to both of you who have actually shared your experience. Apart from technology, is there anything else that should be smart enough in the smart cities? Apart from technology, yes, you have thrown all the technology. Very good. Apart from that,
Sir,
is there any?
basically,
Yes,
sir, may I add something?
please.
Sir, if we are using the technology or digital system to address a common human problem in the society,
Yes.
so then we say we are planning for a smart city. It's
All
something innovation or something new we are introducing to make a lifestyle of a human being better. That is a smart city by making use of technology.
okay. Very good. Once
May
again.
I?
Yeah, please.
Sir, first of all, I introduce myself, Professor Hitesh Parmar from Saliter Sal Education System, Ahmedabad.
Very good.
Uh,
Yeah,
According to me, sir, suppose a thing which can be learned from its past experience. Okay,
yeah,
suppose
yes.
talking about smart garbage system.
Very
Okay,
good.
suppose talking about automation of traffic rule break, something like that. Okay,
Very good. Yeah.
suppose check the quality of our water in automatically. So if we are collecting those things together, okay, then we can say that we will have something smart stuff with us.
All right. Now, my question to all three respondents, two ladies and this gentleman, if suppose using technology, if I am creating a lot of wastage, a lot of garbage, a lot of pollution, a lot of pollution in different forms, all right, and I am basically impeding the growth of the coming generation. I need a lot of money from my regulators, from government and everybody just to run the system, huge expenses, because government also has got a limited expense. So there are multiple factors what I told that I am creating, I am basically contributing a lot to, I'm basically polluting. I am emitting carbon. I am endangering the air quality. I am impeding the growth of the young generation. All right. I am spending a huge money as compared to the normal towns and normal cities. Now, ladies and gentlemen, tell me something. is that kind of city still a smart city? And definitely it has got all technologies, whatever this madam told, that there are sensors, there are monitoring system, there is traffic management system. This gentleman said everything. My single question, if I am causing more harm just to have a quality life or just to have so much of technology, but at the sake of a lot of things, and that is not friendly, that is not economics friendly, that is not young generation friendly, and that is not environmentally friendly either. Do you still call that city as a smart city?
No, sir. The
Why?
solution should
No,
be
sir. No, sir.
sustainable.
Yeah. Yeah, very good. Very good. Go ahead. Why? Why? Just now you only explained, and then I'm throwing all those technology, sensors, smart management, whatever you all three respondent told me, I have already put this, and this is what that came from you only. So I have put everything, but now I am creating, I am endangering a lot of things. Why it is not a smart city?
Sir, I said like we are addressing a problem. It should not create another problem.
Very
Right?
good, excellent, excellent. Yeah, please go ahead. And
That's it, sir. We want to hear from you. Actually, you have highlighted the point of sustainability and how to
exactly.
restore or keep
All
our
right.
system.
Okay, I can see one gentleman has raised hand and his name is unverified. Oh, my friend, okay, please unmute yourself and I believe that you want to say something. Please go ahead before I revert back to this lady professor whom I'm talking to. Nothing? Okay. Now, madam, just now you spoke something sustainability. Just now you spoke. Is that correct?
Yes, sir.
Please, can you please tell me what sustainability is? What is sustainability?
Sir, may I speak?
Please, please, please. In fact, I want
So
to
may I?
make this session interactive. Please go ahead. I want to hear more from you because I'm here
Sir,
to share. I'm not a professor. I'm not going to teach you. In fact, I'm sharing my industry experience as far as it
Sir,
relates to smart city. Yeah,
sustainability.
please. Yes. Chalo. Yeah,
sir,
please go ahead. Yeah, go ahead.
Yeah. Sustainability, like,
sustainability is sorry,
Yeah,
ma'am.
please. Yeah, yeah.
yeah, please go ahead.
Sus-
I'll answer later. आप
Yeah,
बताइए,
please go ahead.
please.
According to me, sustainability is using the resources in such a way that they are available for the present and also for the future generation.
Very good. I know. Sorry to, but I can judge that you have read this from somewhere, but I still
No, sir, I
appreciate you.
teach
Not
this
a
subject
problem.
that is.
Very
No,
good.
sir.
Okay. No problems. It is very good. I can give you 99 out of 100 because you have missed only one thing which I'm going to share. All right. Okay. Sustainability, just now you said that it is how we use it. So if I give a multiple choice question, that is sustainability a science? Is sustainability a technology? Is sustainability an art? Or is sustainability a goal? What is
Goal.
sustainability? Goal.
It's
What
a
kind
goal
of goal?
Sustainability is a goal. It's a
What?
goal.
Okay. It is goal for whom? It is a goal for
for all
whom?
human beings. It's all for human
Excellent.
beings.
Excellent. Now I can give you the last mark also. Now I can give you 100 out of 100. Ladies and gentlemen, sustainability is a societal goal. So until and unless societal goal sustainability is embedded into smart cities cannot be smart cities because you cannot step on somebody's toes just to rise for yourself only. You have to ensure that our practices, our smart city is sustainable. All right. Now, just now she mentioned sustainability, that the way we use it. Okay. Sustainability has got three pillars. First is environment. Second is economy. And third is that it should be friendly to the younger generation or the coming generation. So smart cities, whatever way we have developed, we have to ensure that none of the practices, none of the technology, none of the system, none of the features, anything that must not endanger the environment, number one. And secondly, it should be contributive to economy. It should not be a burden on our economy, because we should be in sort of we should be using all the technologies efficiently, and our productivity should go up. Well, we have invested some money, so basically it should be a contributor to economy. And finally, whatever we are doing, until and unless it is supportive to our coming generation, it is not that I eat up all the food and I don't leave everything behind for my son, for my daughter, and for my grandchildren. I need to ensure that whatever food is there, it should be good enough. Apart from me, there should be enough food left for my younger generation. So what I want to say, that it should develop promotional prospects for the coming generation to come. Until and unless we have not ensured enough prospects and prosperity for our younger generation, that practice is not sustainable. And all these three pillars of sustainability, if they are not embedded in the smart cities, your smart city is no longer a smart city. Can somebody challenge me, or can somebody, or does anyone have a question, or do you believe that I'm something off track or I'm missing something? I will be more than happy to accept your suggestions. Anyone? You agree with me? Or if
Sir, may I?
anyone, please go ahead.
Sir, it is practically possible that we can get three pillars simultaneously.
Yes. And we have to ensure, then only you can say that it is a sustainable practice. You go to the United Nations website and you will find that there are as many as 17 sustainability development goals. And each of the goal, some or other way, it contributes to all these three pillars. It can be smart education, it can be smart clean energy, it can be good education follow, it should be opportunity, it will be a you go to sustainable, because I don't want to distract from the topic because the time is limited. But we, until unless we ensure that all three pillars are addressed adequately, your practice is not sustainable. And if you're not sustainable, that means you are not smart. Is that correct?
Okay, thank you, sir.
All right. Anyone, my friend, please feel free to challenge me.
Sir, your voice, sir, your voice, sir, your voice, sir, your voice is not audible and screen is also not moving, sir. Sir, your voice is not audible and your no, sir, your voice is not audible, sir, and your screen is also not moving, sir.
Can you hear me now?
Yes, sir. Yes,
Yes,
sir. It
sir.
is.
Yes, sir.
Okay,
Yes,
my
sir.
friend, I am sorry. This technology, sometimes it is painful. I don't know what happened. And somehow it was broken. But I believe now you can see me and you can listen to me. Is that okay?
Okay, sir. Sir, could you share your screen, please, sir?
Yeah. I'm going. But just before that, up till now, whatever we have discussed, does anyone have any question? Does anyone have any question? We spoke about smart cities, we spoke about sustainability, then we spoke about integrating sustainability into smart cities to make sure that we are following smart practices. Does anyone have any question, any concern, or is there anything where you do not agree with me? I'm more than happy to discuss that before we go to the heart of our session, which is telehealth and remote patient monitoring.
Sir, I have a
Please.
question, sir.
Yeah, ask me.
Sorry to interrupt you, sir,
No
but sir, I'm
problem.
totally agree with that. Economical friendly, I'm
Yeah.
agree. Okay, then environment friendly, I'm agree. But youth friendly, sir, it is not digestible for me, sir, because human nature is different in each and every era, sir. So how we can say that sustainability has a the major component as a pillar, okay, for a youth.
Okay. Here I would like to explain that, see, our policies and our practices should
Hmm.
be in a way that we should must not exhaust all the resources. Just now
Okay.
I gave you a classic example. If suppose in my home I am there, I have got my son, I have got my grandchildren also. And if there is a food, limited food, as on today's date, and it is getting recouped every, okay. So I have to ensure that very first thing, if today I'm eating something, I must ensure that my son and my grandchildren are also able to eat today. Number one. Number two, I must create such a situation that I am able to earn for tomorrow also, and not only for me, for my children and for my grandchildren also. Number three, I must also educate and equip my son and my grandchildren to be able to take over once I am no longer in this on this planet. So it is the smart practice. When I say for future generation, that means I'm not talking about anybody, any individual's mentality, his thinking, his thoughts. You cannot please everybody. You cannot always work for the entire community, but our efforts, our policy, our aim, and our mission should be that it should have enough scope and enough opportunities and enough resilience for adaptability for the coming generation to move that technology, to move that productivity, to move that practices, procedures further, and that also with a scope of further improvement. That is something I am talking about. I am not saying that I'm here to please everyone. No, our policy should be that it should be sustainable. It should always continue. I should not exhaust all the resources. Like there are limited fossil fuel. If I dry up all the fossil fuel, what my grandchildren or great grandchildren are going to use to generate electricity to have their crops and other things. So what I need to do, I have to have innovate in renewable energy technology, clean energy, all such things, so that tomorrow if my fossil fuel they dry up, they are exhausted, still there are technologies in place where my future generation can sustain, can live, and then they can maintain their quality of life. This is what I was saying. So have I answered your question?
Sir, but whatever you said, your last point is regarding, I think so, reuse, repurpose, recycle, and something like that. Okay, sir.
There should be a continuance. I want to say that there must not be full stop. Whatever practices, whatever technology, whatever growth, productivity, that should always go up All right. And our future generation should be able to adapt, and they should be able to take it further, so that there is enough scope for them for their sustainability, and they also have the equal responsibility that they should also be caring for their coming generation, next generation. This I
Oh,
want to say. Okay, if you want, because for the sake of time, I cannot cannot dive deeper. You go on United Nations website, and then they will explain you that why we are focusing out toward future generation. That is one of the strongest pillar. All right,
no, sir.
but I appreciate your question. I appreciate your question. The way you are asking and the way you are thinking is absolutely correct. Maybe if you have further any question, you have any further question, you can send an email to the conference organizer, and then I will answer your question. I promise that whatever question comes to me, I'm going to answer each of them. All right. Okay, ladies and gentlemen, I think we have already spent quite some time. So smart cities, I'm not going to read everything, whatever there is on the slide, because this presentation will be shared with you. But as it is mentioned that we use technology, we leverage technology, we stimulate inclusive growth, and we create a personalized and seem like okay, this is the last topic of our focusing on today's discussion. But what I want to say, stimulate inclusive growth, promote social inclusion, decrease traffic congestion, combat crimes, improve resilience during natural disasters. And then you can see number two, that we have to reduce environmental impact, and then we have to enhance quality of life. When I say quality of life, I'm straight away referring to make sure that our future generation are also able to enjoy the same quality of life, in fact a better quality of life, as we progress further. That is called sustainable. So these days the smart cities, the concept has changed. Now they have become sustainable smart cities. It is not only limited to build concrete jungles and to put all the technologies and put artificial intelligence, communication, blah, 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 blah. Yes, but we still need to look after the society and creating a personalized and seamless healthcare experience by robust communication network, data integration, and artificial intelligence driven insight. This is something we are going to talk about today. All right. Again, but we have to make sure that there are minimal carbon footprints. There should be minimum waste. And if there is waste, we try to explore technologies that we can reuse or recycle our waste. All right. These days, there is no longer the concept of cradle to grave. Now, there is concept of cradle to cradle. That means 100% recyclable. 100% recyclable. All right. So now, let us progress further. How do smart cities do that? These two ladies, professor, and this gentleman, two gentlemen, they have already explained that we embed technologies. All right, we embed system, we embed traffic management system, we embed transportation system. Yes, all these things are done. All right, but there must be some key players also. Okay, which we are going to talk about. When we say smart cities, that we focus on green buildings, which are actually energy efficient designs with renewable energy sources and reduce consumption and emission. Again, we are repeating that we have to focus that our carbon emissions are low as possible, because otherwise that is going to impact our ozone layer. And if the ozone layer depletes, what is going to happen? The sea level is going to increase, and the temperature of the globe, above the entire planet, that is going to go up. All right. The icebergs at our north pole and south pole, they are going to melt. There will be more inflow of water. When the sea temperature goes up, it is going to endanger the marine life. So we are not here just to secure human life. We are equally responsible to secure marine life, bird life, wildlife. That is also our responsibility. There must be, okay, can everyone please mute their mic in case there is any background voice or there is any kind of disturbance. There must be resilient water system. This gentleman just now shared an example. Yes, we have to ensure that there should be monitoring of any leakage and monitoring, and the irrigation water is also optimally used. We are going to, there is a concept of green agriculture. There should be a flood resilient design in our smart infrastructure. These all are included in smart cities. There should be data driven climate monitoring. There are just now this lady professor mentioned that we have to have IoT sensors, we have to collect data collection, predictive analytics, proactive responses, all these things they fall. We have to be a little bit quicker. That's why so that we can talk more about the hardcore of today's discussion. When we say smart cities, we need to ensure that we plant enough trees to mitigate heat island effect and improve quality. That is also something that is required in smart cities. Don't just try to build concrete infrastructure with all the technologies embedded in it. There must be green roof, the way it has been shown here, that create rooftop gardens to enhance biodiversity and reduce energy consumption. That we have to look after eco diversity also. We have to look after biodiversity also. We have to expand our green spaces to reduce flood risk and provide community benefits. There must be, when we talk about, because one lady told that she is from electrical engineering, probably she knows better. I am also luckily from electrical engineering background. We need to have smart grids, adopt decentralized system, integrating renewable energy resources. We have to have microgrids that enhance power supply resilience during extreme weather events. Even in Canada also, where I am living, there every year we are getting wildfires. Every year we are getting floods. Every year we are getting droughts in some part of Canada. North America, okay, USA situation is same. So don't think only don't think that the problems are there only in the developing country. No, my friends, the problems are equally there. In fact, the problems are grave there in the first world countries. We have to ensure that we have to invest in the energy storage system. Maybe it is in the forms of battery, maybe it is in the form of hydrogen. Okay, we have to balance renewable energy supply and demand because we cannot depend on fossil fuel for a long time. Just now I mentioned that there is a concept of cradle to cradle now, which is called circular economy. So there should be a circular economy and there should be waste management. This gentleman just now mentioned, even our organic waste, we need to convert that into energy or to compost to reduce emission. We can reuse that. We have to promote circular economy practices to reduce environmental impact so that there is no wastage at all as far as possible. We have to implement IoT enabled bins to optimize collection and improve recycling. That is another way that how we can reuse our waste also into productivity. So there are key players in smart cities. For the sake of time, all right, I think we have already spent quite some time. So we have to be fast. In any smart cities, all right, we use technologies as mentioned here to improve urban management by optimally using natural resources to minimize environmental footprint. And if you can see, I have written sustainable smart cities meeting the challenges of urbanization in the 21st century. Why? Very first thing, why the hell we need smart cities? Why? Why do we need? Are the normal cities not good enough? In the past, there were no smart cities. But why the concept of smart cities has come? Just to meet the challenge of challenges of urbanization, because everybody okay, most of the people, okay, they try to migrate from rural areas, remote areas to cities for to to look green pastures, to have better employment opportunities, to have better education, to have better quality of life, everything. So that is called urban management. Then to ensure that there are several key players. There are 4G, 5G, Wi-Fi service providers. There must be communication infrastructure providers. There must be semiconductor manufacturers, software companies, cloud storage companies, cybersecurity companies providing building management system, and then companies providing smart healthcare outside of traditional setting, connecting patients, service providers, and data for improved outcomes and efficiency and accessibility, which is the topic of today. Can we proceed further or you have any question? Yes, friends, can we proceed?
Yes, sir. No questions.
So let us start moving towards healthcare challenges. All right. Their data-driven approaches, they improve accessibility and efficiency, optimize resource allocation, and enhance patient outcomes. The target remains that our health care challenges, especially for senior citizens, for people with some sort of limited ability, I don't say disability, with limited abilities, or those who are challenged with some or other kind of they have some or other kind of challenges to be able to live a quality life. So those particular target groups needed to be looked into. Network sensors, wearable devices, smart home medical devices, they all collect real-time patient data using IoT and biometric sensor. I know that many of you are hardcore IoT and machine learning, artificial intelligence experts. They know better that how this IoT and biometric sensors are being used, how machine learning algorithms they are being developed to get the most efficient process, the recipe, the recipe of processes. We have to ensure that there is timely disease diagnosis, personalized treatment plan, and predictive health analytics that can be done by artificial intelligence and big data analytics. There must be robust connectivity and processing for e-health solution using 5G, cloud computing platform. All this we require a smart digital infrastructure. And then on the top of that, we have to ensure that the cost always remain within the limits of the end user. Reduced cost by streamlined processes, optimized resource use, and focused preventive care through smart health solution. This is what we are going to talk further in the coming slides. So the topic that has been given to me is remote patient monitoring and telehealth. Ladies and gentlemen, can somebody tell me what is the difference between telehealth and remote patient monitoring? This topic Javed has given me for today because I have a different thought about it. But before I share my thoughts, can somebody tell me that this remote patient monitoring and telehealth, are they totally separate or they are interconnected, they are interrelated, or they are complement to each other, something like that? Can somebody share some thoughts?
Uh, Excuse me, sir.
Please, your name and your affiliation.
Yeah, my name is Professor Shailesh Khaparkar.
Okay,
I am from Gyan Institute of Technology and Sciences, Jabalpur.
okay.
So, a very interesting question asked by you. What is the difference between telehealth and remote patient monitoring? So, sir, telehealth and remote patient monitoring, I think both are similar words, both are similar technology. In telehealth, we use the communication and these digital gadgets to access the health of the patient remotely. And both are a similar one. In telehealth particularly, we'll take the case studies. So we can use telehealth for the monitoring of cardiac patient and other who are chronic patients. They require the continuous monitoring. So in that case, we can monitor the patient remotely by the telehealth services.
Very good. Very
Am I
good.
right, sir?
Yeah, absolutely correct. So
And
if I, yeah, yeah.
remote patient monitoring again similar to telehealth. Again, in remote patient monitoring, we can use you said, and we can monitor different vital signs of the patient remotely. And we can take one, server that is the medical server or healthcare server, and we can monitor the data of the patient, and according to that we can make positive feedback system. If any say abnormal vitals are coming, then a doctor can take appropriate action for the particular patient by the telehealth services.
Okay, gentlemen, can I say that remote patient monitoring is a subset of e-health, telehealth?
Yeah,
Can
yeah,
I
it is
say
a
that?
subset. Yeah,
Can
yes,
I say that?
exactly. Exactly, exactly.
Does anyone disagree with me? Does anyone disagree with me?
No,
Can
no, sir.
somebody share some more thoughts?
So can we hear your what you said once again, please, sir?
Can I say confidently, based on the narration given by this gentleman, can I confidently say that remote patient monitoring is a subset of telehealth, or it falls within the umbrella of telehealth?
Yeah, exactly.
Yes or no?
Yes,
Yes
yes,
or no?
yes.
No. Does anyone have a different opinion? Does anyone disagree that remote patient monitoring is totally different and it doesn't fall within telehealth? Can somebody, or does anyone have that kind of opinion? I will appreciate if some more thoughts are shared with me. अरे हिंदी में पूछते हैं कि जो रिमोट पेशेंट मॉनिटरिंग है, क्या ये टेली हेल्थ का ही एक हिस्सा है या अलग चीज है? अब हिंदी में ही जवाब दे दो.
मैंने तो अपने थॉट्स दिए थे सर.
सॉरी.
Sir, it's a part of telehealth.
All right. So everybody agrees that remote patient monitoring falls within telehealth. Is that correct? I can see 181 attendees are there, but I don't know how come I am just getting feedback from a handful of attendees only, and probably few are repeatedly they are answering. I appreciate, but I will appreciate that there is feedback from others also. Okay, ladies and
So
gentlemen,
this
let
is
us proceed
Sujata.
further. Ha,
This
beta,
is
yeah, please,
Sujata,
please, yeah. Sujata, you are
assistant
academician,
professor of
or
academician. Academician.
you are an
I do that,
academician from where?
yeah, I say that I'm from Chennai, Agni
Okay,
College of Technology.
okay,
I'm an assistant professor in the computer science and engineering department.
good.
I say that this telehealth comes into your remote patient monitoring rather than remote patient monitoring comes into telehealth. So telehealth becomes a subset of this remote patient monitoring. Because when it comes to telehealth, I feel that a patient could connect with the service. I mean, with the other to the other end where service is provided. Whereas when it comes to remote patient monitoring, we'll be having all the datas. We'll be having all the data related to the concerned patient. So a better service can be provided.
So, if I have understood correctly, Lady Professor, you are saying that telehealth is actually a subset of remote patient monitoring. So, that means telehealth involves only monitoring procedures. It only monitors, but there is no facility or no provision or no extended plan to have virtual consultation. Maybe it is audio or maybe it is video. There is no system to store patient's information, to analyze that information. There is no such provision to ensure that services reach the need of people who are based in remote areas, and there are no such system where people who cannot be treated beyond a certain point, who cannot be treated virtually beyond a certain point, so the system will not allow logistic or enforcing logistic to bring them in person to the nearest facility based on their past record or based on the frequency or their health pattern or any whatever the complication of their problem. Am I missing something?
Exactly, sir.
Hmm.
Because I would like to share a thing. We had students participating in the Smart India Hackathon. So
Hmm.
one of the teams they were given with this particular problem where I don't remember the name of the place. It was somewhere in the North India near Punjab or something, where the doctors are not ready to go and serve the people in the interior places.
Hmm.
So these fellows they gave an idea of this remote patient monitoring. so that they could have a kiosk at the panchayat officers in the villages, and they could serve them. The doctors can stay away and they can serve through this
Mm,
through this
mm.
the service,
All right.
through the
Okay.
system.
Now, okay.
Yeah,
Okay. Now, Professor, once again, I appreciate your thoughts. And with my all respects and
thank you.
regards to your opinion, suppose if you are sick and you are at a remote location and I am able to monitor you, but I am not able to action on the observations which are being collected by monitoring you, do you think that I am still able to close the loop or I am not? Because if I just monitor you and if I see that you are not on the right track and then you require further procedures, and by just monitoring, all right, that is not going to help until and unless I am going to analyze your information, I am going to action on the information, and I have to initiate necessary mitigating measures or further investigations which might require an in-person attendance. So will that be a comfortable situation saying that telehealth is a subset of remote patient monitoring? Because here you are simply
No,
able to
no.
monitor, but just this is what
Yes,
you
yes,
this is what you said, that monitoring,
yes.
actually telehealth
Sir,
is a subset.
sir,
I believe it is other way around unless somebody else has got a different opinion. Yes, gentlemen, please go ahead.
yeah. Sir, you said about the telemedicine because remote patient monitoring is only monitoring, and
Exactly.
telemedicine is a remote patient monitoring along with 360-degree feedback. I mean, interaction between
Exactly.
patient and doctor in real time.
All right. Any more thoughts? And I believe
I agree now.
professor
I agree
pro,
now.
professor, you agree with me now?
Yeah, exactly.
Yes,
No,
yes.
that lady professor from Chennai.
Yes, yes, yes. I agree. I
All
agree.
right.
Actually, I was thinking of remote patient monitoring. I thought of that. The other thing also comes into, but now it is
Sure,
I'm
sure.
clear that this comes into
Okay.
telehealth.
All
Yeah, thank
right.
you.
Okay.
Thank
Since you
you.
are from
Yes.
Chennai, I would like to share that my birthplace is also Chennai. I was
Oh,
born in Gindi. All
oh,
right.
fine,
Very
fine, fine.
very long ago. All right. Okay. Yes, gentlemen.
Okay.
I
Thank you.
appreciate with you. Yeah, thanks again. Okay, I appreciate with you. All right. So now this remote patient monitoring, again, I'm not going to read everything. And if you can see in the image also, all right, it offers ways for healthcare practitioners to gather real-time information on patients' physiological conditions. All right. It is basically, it is when you go at the policy level, it is a strategy that offers a way for clinicians to observe patients' parameters remotely and to intervene if abnormality appears, and that is where your telehealth comes into the, okay, intervention is required. That if I see that somebody is cheating or somebody is doing bad thing, somebody is okay doing crime, until and unless I am going to catch hold of that guy and stop that abuse or stop that nonsense or stop that crime, then there is no point of monitoring. I must be able to action also. So similarly, the scenario with the remote patient monitoring and telehealth. And definitely, it is a cost-saving care technology that allows patient to be at home instead of being at costly nursing home and hospitals and everything. You know how expensive these days. The moment you step into any hospital, money flows like anything. All right, and even healthcare practitioners, they recognize this remote patient monitoring as an increasingly relevant tool for patient care, and many find it acceptable for their practice. Okay, going forward, we are going to share the discuss the challenges also. All right. These are the examples of remote patient monitoring. Just now, we have already mentioned, all right, that there are smart scales, a digital thermometer, wearable sensors, blood pressure cuff, ECG patches, Holter monitor, event monitors, pulse oximeter, smart pyrometer, peak flow meters, fetal monitors, especially for pregnant women, maternal and prenatal care. All right, diabetes management, glucometer, continuous glucose monitor, and all these things. These are the example of remote patient monitoring. These are few examples. There is further a long catalog of this, and every day more technologies are coming up. Lot of companies, Siemens, GE, Schneider, they have entered into medical electronics, and every day you will find that they are venturing into new technologies they are developing, all right, for to improve the healthcare management system. Here are few examples. Okay, since I am from Canada and this Fraser Health Authority, it is the biggest health agency operating in British Columbia, where I've been living for the last 13 years. So the care teams virtually monitor your health conditions while you are at home. See, this is a snapshot taken from Fraser Health. This is the example of United Arab Emirates, this Ministry of Health, okay, they have launched a smart application for AI-based remote patient monitoring. This NHS England, they also have got support caring with remote monitoring. This nation, all right, it is from Thailand. You will find that Thailand launches care camera for remote patient care. Saskatchewan, this is one of the neighboring province of British Columbia province in Canada. They also have remote patient monitoring, and it is an interactive virtual clinician patient platform that enables patients information electronically with their provider. And this is something I believe this is, yeah, this is from Australia. You see, AU. They also have remote patient monitoring, and it is a system that allows healthcare professionals to assess, monitor, and care for person virtually. Why I have shared example of all the continents, just to mention that globally at all the continents, RPM, remote patient monitoring, is being used worldwide now everywhere. All right. So now let us solve what is telehealth and is it different from RPM? I believe we have already discussed this. Unless somebody wants to share some more thoughts, we can proceed further. But ladies and gentlemen, please feel free, because I really get boosted up when there are questions or when there are opinions and thoughts from the audience or from the attendees. Does anyone have anything? What is telehealth and is it different from RPM? Does anyone want to share any more thoughts on this? Anyone? Please go ahead. Anyone? My friends, can I proceed further? Can I proceed further?
Yes, sir.
So please
All right.
proceed further.
So this telehealth, again, I'm not going to read everything. This telehealth, it is actually a use of digital information and communication technologies to access healthcare services remotely and manage our health. Mind it, here we are not just monitoring. All right. We are accessing healthcare services remotely and managing our health. All right. It is basically bridging the digital health divide. All right. And I'm taking the example of India. Our Prime Minister, he has recently launched this scheme e-Sanjeevani. It is actually sandbox telemedicine service of India. It's a step towards digital health equity to achieve universal health coverage. All right. It facilitates quick and easy access to doctors and medical specialists from your smartphones. You can also access quality health services remotely via e-Sanjeevani by visiting the nearest Ayushman Bharat Health and Wellness Center. So again, what just now I mentioned, that should there be a need for a physical interaction, in-person interaction between the practitioner and the patient, then telehealth comes into play. All right. And then what is again telehealth? It is use of technology to deliver healthcare services remotely, allowing patients and providers to connect when they are geographically separated. And it can include computer, it can include your mobile phone, it can use your tablet, smartphone. And this virtual doctor visit also through video conference, remote patient monitoring. Again, see, this is one of the subset. Health related education, giving health related education is for also falls under telehealth. And it allows convenient and accessible care for individuals in remote areas or those with mobility issues, those who cannot move, those who are differently abled. Again, I want to mention that this technology is also being, all right, used worldwide. You can see again, Fraser Health Authority, they have got virtual care, a convenient path to care. And then in Teladoc Health in UK, it is a global leader for holistic virtual health and well-being. Again, United Arab Emirates, they have introduced additional telemedicine services to virtual doctor platform. Ontario province of Canada, they have got Health 811. It is a free and secure confidential service you can call or access online 24 hours a day, 7 days a week to get health advice from a registered nurse or find health services of information. This teleassist is one of the leading telecommunication provider in Canada. Okay, in fact, they are offering healthcare solutions. See a doctor, psychologist, counselor, or a dietitian from your phone at your convenience. It is a part of our mission to improve Canadians' access to healthcare. So this is a telecom company, and then what they say, you just download their app. It is similar to eSanjeevani app. So what again I want to repeat that this technology is every day getting promoted and developed and implemented across the globe. Across the globe. Telehealth, and we have of which remote patient monitoring is one of the subset. Now I am concluding that remote patient monitoring is an important subset of telehealth. Unless somebody is thinking differently, I still believe that it is one of the subset. You can see that what is the difference. Remote patient monitoring, it is continuous data collection and tracking of health service metrics. Very good. But this is a virtual telehealth. It is a virtual consultation with healthcare providers and it routine checkups, minor illness therapy that can be given virtually. So, remote patient monitoring, it is a continuous data collection, but it is a telehealth is a real-time interaction, immediate care, and remote appointments that facilitates. Even in Canada, most of the time, whenever I call my family physician, the receptionist said that would you like to have a telephone appointment or would you like to have an in-person appointment? Most of the people they are working in shift and they often do not get time. So doctor comes virtually online until unless physically he needs to investigate or he needs to examine something. So it's a very, it's a win-win situation both of you. Again, telehealth is a suite of services to deliver remote care both in and out of traditional care setting, and it is one of the subset. One of its subset is remote patient monitoring. Because telehealth also uses telecommunication and ICT to provide access to health assessment, diagnosis, intervention, consultation, supervision, and information across distance. But I repeat, it is one of its subset is RPM. Telehealth is a big umbrella. All right. Now, again, just to in the form of image, you will find what is remote image. Okay, patient monitoring using cloud repository, we are having this patient mobile app, we are having medical devices, smart watches for monitoring, but telehealth gives you everything. All right, on your mobile phone you get many facilities. Telehealth focuses more on patient and provider communication to receive treatment efficiently, whereas RPM allows them to monitor the health condition and improved and offer an improved health condition based on the information collectively collected. They collectively possess enormous potential and continue to improve healthcare while leading to the better patient outcomes. So both of them they work together. And RPM being one of the subset, there are many other subsets of telehealth. Collectively, they are improving the healthcare management, healthcare system, and they are finding ways for better patient outcomes. All right. Javed, how much time we are left with now?
The session will be over at
No,
7:30,
no.
sir.
How many more time? How much more time?
20 minutes, sir. 20
20
minutes.
minutes. All
20
right.
minutes.
My friends, I have a bad habit of asking questions. Are there challenges in using remote patient monitoring and telehealth? Do you think that there are challenges?
Yes, sir.
Anyone?
There are.
Yeah,
Yes, sir.
very good. Your name, affiliation, and then your thoughts, please.
I already, sir, interact with you, Professor Shailesh Kaparkar from Gyan Ganga.
Okay, all right. Yes, Professor, go ahead.
Sir, challenges are like data security.
Very good.
Challenges are like accuracy of the sensors.
Exactly. Very good.
Challenges, challenges are real-time patient monitoring.
Very good.
I mean, latency is the also challenge.
Very good.
So, sir, and one secured system is required for this remote patient monitoring. I mean, at last.
Okay,
So these are
telehealth also, do you believe that there are challenges?
yes, sir. Telehealth is one of the solution under the umbrella of this telehealth. There are remote patient monitoring.
Correct. No, but
There, there is
challenges.
telemedicine. Yeah, latency and I mean low cost solutions. These are the challenges.
So are you able to give low cost solution or you are not able to give low cost solution?
Yeah, sir. Low cost. I mean, low cost. It will design like a portable systems for this telehealth monitoring. So ultimately, we will reach on the goal of, I mean, low cost solution.
Hmm. Suppose you have set up all the telehealth facility, but unfortunately there is no power supply, or the power supply is not reliable in that area. So if there is no power supply, there is no internet. If there is no internet, or even if suppose using any UPS or any such thing, internet facility is there, but the people, everybody doesn't have a standby generator or everybody doesn't have a UPS, inverter, whatever, then again it becomes a challenge. Am I correct?
Yeah, yeah. Internet connectivity is also
And
challenge, sir.
and sometimes if power
In
supply
rural
is there,
areas.
yeah, and suppose power supply is there and the internet connection is not working well, then again it becomes challenge. Okay, so this is what we
Yeah.
are going to discuss. So any more thoughts? Any more thoughts? So what our health practitioner, how do they perceive the challenges of RPM? I went through one of the research study, few research study, and I just compiled the information that they believe the healthcare, that means the inner core guys, they said that there is increased workload due to a large amount of patient data. There are constant disease reminders that can increase patient anxiety. This is correct. The same thing if I keep on telling you, hey, you have your medicine, hey, tomorrow you have to go for this, go to for this, lot of reminders. And that also at times make people uncomfortable when that they get too much of information, especially at the higher age group. Since you, most of you, many of you are working in the technology, I even if suppose the algorithm has not been properly scripted and there are challenges with the accuracy, then this limited trust of technology, that becomes a challenge, that how accurate is your data or how accurate it has been analyzed. Many patients, they are elderly and technology sometimes can be disorienting. Ensuring patient engagement and adherence to wearable usage, that is also a challenge. Most of the especially old age people above 75 years, they are not comfortable putting the wearable device either on their wrist or their heart. They just want to throw it away, they are not comfortable. So that is another challenge. And then there is no consensus on financial responsibility, and this is one of the important part, ladies and gentlemen. I don't know if you have encountered this problem of or not. Many insurance company who are offering health insurance plan, at times they refuse to entertain your claim, saying that no, you have not taken in person treatment. In fact, you have taken virtual, and their criteria for allowing the claim or their criteria to even entertain the claims, that is different. And then really it becomes very challenging that for in India, I don't know the medical health insurance that is that much developed or not, but in advanced country in USA, Canada, if you don't have a insurance coverage, you are probably deprived of many facilities. You will just get basic facilities. But for any extended health facility, even the doctor or any clinic, any hospital, they will not even entertain you until unless you have insurance. So for that, if you are in your job, if you are in service, your employer will cover your health. That also up to certain limit. But if you don't have you are not working for somewhere, you don't have an employer, then until and unless you buy an insurance for yourself, health insurance, it is very difficult to sustain in any first world country. And that is why whenever is anybody is coming from India to visit Canada, the first thing I said that, my friend, make sure that your passport is valid for 6 months and make sure that you have enough health coverage. If you don't have enough coverage, you will be in big trouble. But if you are taking virtual treatment, many times insurance company, they are not uh, friendly in reimbursing your or entertaining your claim. And definitely there are private and security concerns also, because if I, even right now also, if I'm talking to someone, if I'm talking to you, and I know Javed is recording this, so whatever I'm discussing, okay, that is for a good educational purpose. Here it is not a problem. But suppose tomorrow if I'm sharing my personal information with you, and you are the doctor that has been documented, and who knows that that information will be spread, or that becomes, sort of viral, or that we get the information get leaked, and there is compromise of security. So most of the people, they in fact say, no, no, no. Even guys, when we are talking on phone, we, no, no, you come to my office, then we talk. People are not comfortable in talking remotely. In fact, people say that, अरे भाई सारी बात फोन पे थोड़ी ना हो सकती है, आपको आना पड़ेगा. What does that mean? Because they want to ensure that there is enough security and privacy when they communicate. And when you are talking in person, half of the communication is done through your body language, your facial expression. That actually expresses, that gives a better indication to the person at the receiving end, that how submissive and how conducive the communication is going on, or the discussion, or where they are heading to. So definitely there are privacy and security concerns. All right. Now, there are challenges of telehealth also. And what do our healthcare practitioners say? So this is true that not all categories of citizens have got enough such technical equipment for telemedicine consultations. And even if suppose they have got, suppose your grandfather, he is of 78 years old, maybe your daughter can use the mobile phone better than you, but your grandfather, he will not be able to use the smartphone and all these features. So they don't have enough, even if they have got technical equipment, they are not comfortable in using them. So for them, telemedicine consultation really becomes challenging. Another challenge, which is mainly in the developed country, and sooner or later it is going to happen in India also, the licensing and regulatory challenges. In Canada, if you are registered in any particular province for providing medical services or as a doctor, you cannot even practice in other province until and unless you have taken license from in that particular province. Even I'm a professional engineer in British Columbia. I cannot practice in other province beyond a certain period. Where is it temporary? For temporarily, I can work there, and that also I need to inform the local regulatory body. All right. Either I have to take license, or I have to inform them. When they allow that within 6 months, you are expected to take your license in the local with the local authority. Otherwise, you simply cannot practice. So similar is the situation with the medical, because USA has got 53 states, 52 or 53. Canada has got uh, 6 provinces, and it has got 3 union territories. I'm talking where I'm living. So in India, this regulatory challenges are not there. Even a person from Chennai, he or she can practice in Delhi. But in developed countries, it is not the same situation. So there are licensing and regulatory challenges. Even if you guys, if you go to Canada or US, okay, you will not be able to practice even your teaching until and unless you are licensed with the local regulatory body. And as I mentioned, many insurance companies, they limit coverage of telehealth services or reimburse them at lower rates as compared to in-person consultation. The integrating telemedicine with electronic medical system, EMR, is also tough, because most of the time their software, it is not compatible across any country. Maybe Ontario province is using a different software, and British Columbia province is using a different software. In India also there could be a challenge. Yes, yeah, somebody is saying something. Tell me. Hmm? Yeah, please go ahead. Somebody was saying something. Can you hear me? Can you hear me?
Yes.
Yes,
That's
sir.
good.
Yes, sir.
All right.
You
Okay.
are
No, actually,
audible,
I
sir.
thought somebody was saying something. I thought that's why I stopped. Yeah, and definitely telehealth. There is always limited examination of patient. So there is an inability to perform a full physical examination. So if there is an in-person visit, that is definitely better. But at least something is better than nothing. All right. Data privacy and security concern, vulnerability to hacking, leaks, and unauthorized access. That is another challenge. All right. And then there are legal gaps and ethical challenges, also difficulties in accountability and creating a bond of trust that is often formed through face to face contact. As I just now mentioned, if there is a face to face interaction, situation is completely different. But with virtual meetings, even with the virtual hearing at the court, all right, okay, people always try to have in person hearing. Let us move further. So, are there solutions for the challenges in using RPM and telehealth? This is my last question because now I think we are left with only few minutes. Here I would like to have your opinions. Are there solutions? Because until and unless there is a solution, it is not a problem. Then it becomes a situation. But if there is a problem, definitely there is a solution. If there is a challenge, there is a solution. So, what are those solutions? I can see that Manik Nandan Rangaswamy, he wants to share his opinion. Yes, Manik Nandan, please proceed. Manik, please proceed. Unmute yourself. Gentleman was trying to say something. Anyway, sorry. Yeah. How do we resolve the challenge? There, we need an intervention of policymakers and regulators to resolve most of the challenges. All right. There is a need to expand the interstate licensure agreement for physician. Don't limit the boundaries of practice of any professional, maybe a doctor, maybe a lawyer, or maybe an engineer, or maybe an educationist. All right. We have to ensure that there is interlicensure agreement that if somebody has registered in Uttar Pradesh, he can always go and practice in Andhra Pradesh. If somebody is licensed in Washington state, he or she should be able to perform, to practice in Atlanta state also or in Michigan state also. All right. And there should be harmonization of regulatory requirement around jurisdiction. Because if the jurisdiction, if there is a legal complication, then it becomes very challenging for the practitioner to now fight the long legal battle, and you end up visiting your lawyers, and you end up attending your hearings at the court. So that regulatory requirement is another challenge. There must be simplified procedures for physicians to obtain license in other states or countries. If a doctor in UK, he should be equally allowed to practice in India, and the insurance companies must entertain the claim even if the practitioner has given consultation while sitting in a remote region or at a place which is geographically apart from that location where the patient is based. All right. There must be training specialists and practitioners to use telehealth system. At times, the practitioners we are using, because they are doctors, we cannot expect that they can use the technology so easily. They need to learn, so we have to provide training to them. All right. The country's law should mandate reimbursement or guarantee payment parity for telehealth services. I mean to say the insurance companies. All right. There is a need to develop and implement a unified standard for health information exchange at national and international level. You cannot say that no, this is my patient, I cannot share this information. Most of the time, banks do that. They don't share the information. Yes, so long as privacy is maintained, but even within the banks, all right, they must be able to and share the information, and especially where the human life is involved, all right, then there should be a healthy health information exchange system. We must develop hybrid models of care, allowing telehealth for initial patient triage and then monitoring and then follow up. But there must be face to face visits for diagnostic and procedures requiring physical contact. Don't try to overrule or bypass physical contact or somehow try to put supremacy. No, 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 this can be done virtual. No, whether in person is required, in person is required. All right. Tele health services have end-to-end data encryption. This we have to ensure. You guys, you are IT expert and ICT and AI and machine learning. You know this better. There must be multi-factor authentication. There must be intrusion detection system and regular security audits. There must be a strong legal framework considering the specificities of telemedicine practice, jurisdiction, liability, and quality standards. All right. And if the computer is not able to, if the patient is not able to use computer, or if he doesn't have access to internet, he should be allowed telephone counseling also. Yes, I can see that Manik Nandan again raised his hand. Manik, this time would you like to say something?
Yes, sir. This time I'm able to
Please.
unmute
Yeah, yeah,
myself.
yeah,
I
yeah.
guess I guess
Yeah.
I
And
can
your
speak. Sir,
affiliation, my
actually,
friend, your affiliation,
yes,
you
sir.
are?
Sir, actually, so you really want to like you asked a question.
My friend, you are an academician or you are an industry professional?
So actually, I worked in HCL Technologies in an clinical effect analyst in a medical devices, and
Okay.
after 3.5 years, I'm now working in a college as an assistant professor. So
Okay.
so I was in a regulatory. So here, so the moment you ask the RPM and telemedicine, so how that challenge, I thought of adding one thing, and I really want to know and one thing from you, sir. So here,
Please.
so I have compared. So you well stated Canada and US are not that easy to find regulatory and doing things, because you know what's it? Every time Indian complaints came to us in the regulatory of medical device, we take 60 to 30 days. But moment the FDA compliance came in US, it will be in a window of 48 hours. So it's not something like the life of Indian is cheap and life of US citizen is costly, because the regulatory is getting different. So my point, so moment we got all this. Technology advancement in RPM and telemedicine, sir. So, do you think we are getting close to the person, or we are getting away from the person in terms of AI or machine learning and automation? Because every time the medical devices came to us in a desk of failure, we will go for corrective and preventive action. So we go for a lot. We check for the patient diagnosis, healthcare professionals' instructions. Lot of things involved, sir. So in terms of RPM and telemedicine, so what we are thinking, we are getting away from the person for the accuracy results, or that is a one bigger question in being an Indian. I really curious to ask with you, sir, how you
Hmm.
see this trend, sir.
Very good question. Very first thing, your question is very good, and I must appreciate. And you have really raised a very good topic, very important topic, my friend. We need to set up some KPIs. We need to set up some performance indices. All right, and then we have to have a very strong evaluation system. Any system, when it is introduced or it is implemented, it is always kept under uh, strong monitoring, and I cannot say surveillance, but we evaluate under small evaluation, and we need to have periodic evaluation, and then we have to check that whether the project is really meeting its goal. Are we really able to extend the best possible care to the end user? And the feedback comes from the end user. Whatever technology, if you are implementing, if the end user is not getting benefited, all right, then your technology, your system, your regulations, your procedures, they are all not of use, and they are really not effective. If suppose there are very good rules, regulations, and everything, they are in place, but if it is taking very long time for the patient to get benefit of it, then what is the use of implementing such technology where our end user is still stuck in your bureaucratic traps? He is stuck in your regulatory, and the moment, these days human memory or human emotions are so impulsive. The moment you try to you start giving reasoning explanation, this requirement, this, he will simply say, okay, no, okay, I will go to another place. Even if you go to any shop also, you go to any restaurant, the moment you see, okay, okay, time lagega, acha chalo dusri jagah chalte hain, that means, oh, it is taking more time, okay, let us go somewhere else. But at times, there are restaurant, you have choice, all right. So telephone sim provider, you have choice, but healthcare, you don't have choice. Electricity, you don't have choice. Utilities, you don't have choice. So what you have, the question which you have raised, that is extremely good, and I really appreciate your thought. So if you ask my opinion, I would, the moment any technology is implemented, or any practice or any procedure, I will ask, before implementing, I will say that I want to have its KPI and performance indices, so that after 6 months I want to do a 6 monthly review, and after 1 month I will see review, and then I will collect. In fact, I will appoint an independent survey company to go and get the feedback of the end users without prejudice and without unbiased opinion, and that will tell me that whether the system that has been implemented, that requires further tweaking, or it is running well. That is the only way. It is the end user who is going to tell you. There is a simple saying: if your customer returns back to you without, under no pressure, if he returns back to you, that means your services are good, or your product is good. The best benchmark is, if without any pressure and without any compulsion, your client is coming back to you, that means you are doing good. That is the end. That is the bottom line. And not only for this telehealth or medical, any services. If the client is reverting back to you without any pressure, under no pressure, he is coming with his sweet choice, then you are good. And if suppose somebody is coming, maybe you are a utility service provider, maybe you are a health service provider, any services provider, all right, or you are a government officer, you are an income tax officer. If somebody is entering your room with an anger and he is leaving your room with a smile, that is your performance. Finish. That is the end to it. All right, irrespective of the fact that whatever profession, whatever services you are providing, if you are a vendor, if you are a service provider, or if you are a consultant, if the person is leaving your room with a smile, that means you are doing good. That's it. I believe I have answered your question. Before I have my final note, does anyone have any other question?
Hello.
Yes,
Sir, good
please.
evening.
Name and
This is
affiliation.
Mohit Khilwani. This is Mohit Khilwani, and I'm an academician. Sir, I think there's a problem we should also be discussing about. Like, I am a patient, I'm taking a remote assistance, and the medicine I have been prescribed is not available with me
Hmm.
in the location where I am. So, in
Yeah.
that case, don't we think we should be addressing this problem as well?
Yes, absolutely yes. Absolutely yes. Very first thing, my friend, that there should be a feature that, I don't know the current system in India, but in Canada, in US, the doctor, even a single medicine, you simply, very first thing, you simply cannot go to any medical shop to get any prescribed drug. Yes, you can get the over the counter medicine, which is called OTCO, over the counter, like pain balm or some like cup or the small thing, all right. Or maybe you want
Mhm,
to have an Advil or something like, all right, aspirin, all these tablets you can get. Any prescribed drug cannot be, okay,
mhm,
sold by any shopkeeper, medical store. Number two, the doctor has to write, and what happens, doctor straight away sends your prescription to the medical store, and you just get a copy. And sometimes you don't even get the copy, and then you have to go to your pharmacist, and pharmacist will give you the medicine. In case pharmacist doesn't have that tablet, that pill, that syrup, or any that surgical equipment, it is medical source responsibility. He will revert back to doctor that doctor, you have prescribed this pill to this gentleman, but we don't have this, and it is not even available in the entire state. Then it is doctor's responsibility. Nowhere patient is responsible to run between the pillar and the post to get the medicine. Get the medicine. It is not. It is the. It must be the responsibility of the system. So answering back to your question, it is a very, 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 very a key point, a very important thing, and very a crucial thing, that our system should be strong enough that patient is not harassed due to the unavailability of any particular drug, any particular system, or any particular surgical equipment. I fully agree with you. All right. Any more thoughts, my friends? No? All right. Because I
So
think we are
one
running
more
Sir,
short.
question.
Yeah, 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 yeah. Please name and affiliation
So
sir, my name is
sir,
Professor Shailesh,
from.
Gyan Ganga Institute of Technology
Okay,
and
yeah, all right.
Science.
Okay, so my friend, actually, I don't have any system where I can go.
Okay, okay,
I
okay.
can know that if the same person is asking. Okay, yeah, yeah. Please, Kalish, go ahead.
Sir, nowadays IoT and AI are very much important in case of in any field, particularly in healthcare field also.
Yeah,
So now AI is, I mean, decision support tool for the doctors.
sure.
So, sir, in India, I think doctor, I mean, not using AI for disease diagnosis and all those things. But in Canada and in other countries, in telemedicine, whether the AI is using for decision support system, and how much is the worth of AI in a telemedicine for
Oh,
real applications and real telemedicine application. That is my.
okay. Well, again, Sharish, very good question. Okay. See, in US, in North America, even in Europe also, any professional, he is much more concerned about his license and his professional responsibility rather than his job. I repeat, Suresh Vishwakarma is more concerned about his professional integrity, about his professional license. All right, because in these developed countries, if once you have lost your license, you are like a stone. Whatever knowledge, whatever skill set you have got, if you don't have license to practice, because job once lost, all right, okay, that can be had together again, but license cannot be. So what you are saying, use of artificial intelligence, everybody wants to make life easy, but he will definitely ensure that his professional judgment and decision making is not compromised due to the use of artificial intelligence. It is required, very good, but he is more concerned that to ensure that the informed decisions are not get hampered. All right, I have already been told that we are time out. Okay, if you have any specific question, please send an email to me. And just I want to conclude that RPM and telehealth technologies, they are being adopted and implemented worldwide as an efficient and cost-effective means for delivering and accessing quality health and services. And they will that its acceptance will continue to increase as patients and provider becomes more adept at and comfortable with using technologies instead of face-to-face interaction. So, ladies and gentlemen, once again, I am very much thankful, grateful to the organizers, and thank you very much for your patient listening. I think I did not bore you too much, and I did not harass you with too many questions. And I believe it was a very good interactive decision. And I will appreciate your feedback. I will appreciate your question if you have got any. So, see, I did a lot of homework before I came online to talk to you. All these references I used. So once again, thank you very much. And now I am stopping to share my screen because we ran out of time.
Thank you so much, sir.
Thank you, sir. Thank you very much, sir.
Thank you. My pleasure.
Thank you.
My,
Thank you
my
so much, sir.
pleasure. All right. Okay.
Yes, sir.
Okay.
Thank you. Thank you.
All right. Any other question? Anything else? Anything else?
Okay, dear participants, this side Dr. Javed Khan, coordinator of this Atal FTP. So thank you so much, sir, for delivering a very wonderful and very informative and interactive session. Your expertise, practical perspectives, and engaging the presentation is greatly acceptable. Understanding of the emerging possibilities in the smart city system, healthcare challenges, data-driven data-driven approaches for the remote patient monitoring and the telehealth in the smart city and the challenges in the telehealth domain that is also considerable for the all participants and opening the new doors for the research. And we sincerely appreciate your valuable time as well as the meaningful contribution for our program. Thank you so much on a behalf of Gyan Ganga College. Thank you so much, sir. My dear participant, within a couple of minutes, we will start the second session. I request to all participants, please switch on your video cameras for taking a snap for this session. Again, I'm repeating, I request to all participants, kindly switch on your cameras to taking a snap of this session. So thank you so much, participants. Now, in a couple of minutes, we will start the second session. Good evening, all the participants. Am I audible to all?
Yes, sir.
Yes, sir. You are good.
Yes, sir.
Okay. Let's start the second.